Hello, everyone. Thank you for joining us for our webinar on getting the most out of your preventive care bonus potential. Today, we will share some key points about what to do and what not to do when thinking about billing for your preventive care bonuses. Let me start by introducing myself. I'm Maral Sanassian, the Director of Client Success at drcare. drcare is the largest provider of billing and practice support for over 2,500 physicians across Canada. On average, we have helped doctors recover $25,000 to $30,000 of revenue per year. Our solutions and services are designed to help doctors ensure that they are maximizing their revenue, improving patient care, and growing their practice. The purpose of today's program is to provide you with some insight on how to bill your preventive care bonus. A lot of times, we do find physicians tend to forget about the bonus because it happens only once a year. However, there is a lot of money that you can receive from the bonus if you stay on top of billing and tracking for the care that you provide. The preventive care bonus is one of the 6 major income streams available to FO physicians. It is a little bit smaller than your fee-for-service and your access bonus streams, but it is still a very good revenue opportunity. There is almost $13,000 available in bonus potential for providing high levels of preventive care screening and vaccination. The average physician will earn about $8,500. However, we work closely with our physicians to attain as much of that bonus as possible. The bonus levels are based on a percentage of patients screened or immunized who are demographically targeted. So for example, if 75% of women at risk for breast cancer have a mammogram, you are eligible for a bonus of $2,200. Here are the 5 categories with specific age and interval requirements. The ministry sends physicians preventive care target population reports twice a year to assist with your preventive care efforts. You always want to make sure your submission date is March 31st of the previous fiscal year when submitting for your bonuses. Here's a quick billing reference guide we have for FO doctors that has all of the relevant codes for preventive care. This includes the exclusion codes and the tracking codes that you should be mindful of when providing preventive care services and/or flagging patients who are not eligible. You can find the link to the guide in the description box below. Now, let's look at the differences between billing and tracking codes. Some of the billing codes will track the preventive care visit automatically. However, not all of them do. And therefore, we do recommend that you enter them in yourself. As you can see in the chart, there are different tracking codes for each category. So you would submit the relevant tracking code based on the relevant screening category. This will make your and your staff's life much easier when you do get your target population report at the end of April, as your preventive care efforts would be more accurately tracked. For the exclusion codes, if the patient is not eligible based on the ministry's criteria, then we want to make sure that those codes are submitted. A colonoscopy under the colorectal cancer screening category is good for 10 years. However, the ministry may not track it for you automatically as an exclusion. Therefore, it's best that you do so yourself. Let's go into a little more detail in each one of the preventive care categories. For flu shots, the target population is everyone 65 years of age and older, and we use the Q130A tracking code. The service interval includes 1 flu shot annually, performed before January 31st of the fiscal year the bonus is eligible for. The challenge that physicians are facing now is that patients can get their flu shots in so many places. For example, they can get them from their local pharmacy, from their workplace. And because of this, physicians don't always know if their patient has or has not gotten their flu shot. We do recommend that physicians implement a standard practice and ask all of their eligible patients whether they've received their flu shot, and if so, track it on the spot. In addition, if you are in a medical building that has a pharmacy and you suspect that your patients are getting their flu shots there, you could make an arrangement with the pharmacy to send you a report of which of your patients have gotten the shot. Alternatively, you can give them a list of your patients that are 65 and older and are eligible, and they can take it off for you. You can also set up a similar arrangement with a neighborhood pharmacy. Regardless, we do recommend that as a best practice, you ask your patients that come in if they've gotten their flu shot, and if so, document it from there. Childhood immunizations. The target population here are infants between 30 and 36 months of age. The tracking code is the Q132A. The service interval includes patients who have received all immunizations as recommended by the National Advisory Committee on Immunization by their 30th month of age. There are no exclusion codes here. A challenge is that some parents refuse immunization for their children. So we've seen some instances where physicians don't roster those patients. That is one way of doing it, because if you have 4 patients and only 1 doesn't get their vaccinations, then your bonus category drops down to 75%, in which case you won't receive the bonus. If you have 4 patients though, and you choose to deroster that 1 patient to bring the total down to 3, your percentage capture rate will increase to 100%, and you will then get your bonus. For the PAP, the target population is females between the ages of 21 and 69, with the Q011 as the tracking code. The PAP is done every 3 years. The exclusion code, which is Q140, is used for patients who have had a hysterectomy or cervical disease. A friendly reminder that you must fill the exclusion code every 3 years for eligible patients. Some of the bigger challenges that we find in many clinics that we're working with are cultural barriers. Unfortunately, patients refusing screening is not an eligible reason that you can use an exclusion code for. Regardless, most physicians are able to achieve this screening category and almost always get the maximum bonus available. The mammogram is for females between 50 and 74 years of age. The tracking code is Q131 and is done every 2 years. The exclusion code is Q141 for a mastectomy, or if the patient is being treated for clinical breast disease. Again, you must fill that exclusion code every 2 years if your patient is eligible for it. A challenge is that the Ontario Breast Screening Program clinic screenings do not necessarily show up in the ministry reports. However, the clinic does send physicians a report and provides an update on your patient, so you can bill for the tracking code then. Colorectal cancer screening. The target population here is males and females between the ages of 50 and 74. The tracking code is the Q133 and is done every 2 years. The exclusion code is Q142 and can be used for the following circumstances. 1, there is known cancer of the bowel. 2, the patient is being treated for inflammatory bowel disease. And 3, the patient has had a colonoscopy within the past 10 years. Some of the challenges here is that people don't like getting their screening, and there are also cultural and religious barriers as well. It is a tougher category to achieve, but we have seen more and more physicians attain the highest level of 70%. Moving on to the logistics about billing. How do you calculate your screening levels individually? The ministry sends out a report in April with your previous fiscal year's preventive care tracking data. You're also going to get a report in October that we use mid-year to see what you have done since April and who the patients are that you need to contact moving forward. That's where we can come in and help, but we will get into that a little bit later. This is a sample of what the report is going to look like. It's going to show you the patients and the category, whether they have had the preventive care service or not, or if they have had an exclusion code built. We want to make sure that this is as complete as possible with all the tracking and exclusion codes that you're going to be billing ahead of time. In order to calculate your screening levels in each category, you will need 3 pieces of information: the number of patients within that category, which is your target population, the number of patients screened, and the number of patients excluded. The calculation would be the number of patients divided by the total population eligible times 100 to get you the screening level percentage. So now that we've calculated their screening levels individually, we move on to the next step, which is submitting the appropriate billing code for the level of screening within that category. Now you can refer to the chart on the screen to determine how much of the bonus you will receive depending on what percentage you have achieved. For example, for the influenza vaccine, if you have 100 patients that are over 65 and you captured 60 out of that 100, you're going to bill for 60%, so the Q100A, and you'll receive $220. If you got over 80%, you're going to bill the Q104A and you will receive $2,200 as a bonus. From the billing perspective, we want to date the submission March 31st of the previous fiscal year. Each ministry fiscal year runs from April 1st to March 31st. The bonus submission is subject to a 6-month stale dating rule. Therefore, we want you to submit your bonuses before the September 18th billing cutoff each year. The bonus can be billed through your EMR using a dummy patient, or you can submit the bonus via paper as well. In your RA report, the preventive care section will provide a breakdown of all your 5 categories and how much you have achieved from the previous year. We hope that if you have had a lower number last year, you get a higher number this year and that you maintain it moving forward. As we mentioned previously, the ministry reports should be a starting point for calculating your attainment for preventive care bonuses. The reason for this is because they do not capture the services provided that are not directly billed by OHIP. So flu shots, for example, given by the employer or the pharmacy, mammograms performed at an Ontario breast screening program facility, those are the ones that don't get tracked properly for you. So you do need to make sure that you track them yourself properly. Another reason is that they don't capture services which slip through the cracks and are not billed. For example, if you billed for the PAP, but the health card was expired at the time and it never got paid, it would have come through as an error. So those are areas you are going to have to review in your ministry report. You want to make sure that every patient you believe to have had the service did in fact get tracked properly. And lastly, some categories get tracked automatically and some do not. So as I said earlier, some of the billing codes will track and show up in the ministry report, and some unfortunately won't. We want to make sure that you are being diligent in billing all tracking codes as often as possible. Let's go through some key takeaways. First, submit your tracking codes regularly for every category to ensure it is reflected on your ministry reports. Second, bonuses have to be submitted by the September 18th cutoff with a service date of March 31st of the previous fiscal year. Targets attained can be billed through your EMR using a mock patient or via paper. Higher levels can be resubmitted and the ministry will pay the difference. If you happen to submit at the beginning of May and you have decided to work with us and have realized that you've actually captured a higher bonus level, you can resubmit to that higher level and the ministry will pay you the difference. Our Preventive service by drcare is an all-encompassing managed service that helps physicians accurately identify and connect with patients overdue for screenings. We analyze your ministry reports, your EMR data, and your screening activity report from Cancer Care Ontario, also known as the SAR, to reach out to patients due for screening, and then submit your bonuses on your behalf. We're basically going to collect all the information possible to support you in optimizing your preventive care screening and bonus capture. By working with us, we will save you tons of time because we're going to contact and remind your patients who need the preventive care service. So if you start working with us now, come October, when you get that mid-year report, we're going to make calls to eligible patients. We're going to make sure that all those patients get reminded of their screening tests and come in, and we're going to make sure that they're tracked properly. We work to streamline practice efficiencies and take the stress off of you and your staff to help you focus on improving attainment levels, which equals better patient care. We also have our practice care service that can help you with managing your preventive care billings. Practice care is our practice management and optimization service that helps primary care physicians optimize their practice with actionable insights and automated billing. In our practice care report, we provide you with a high-level snapshot of your latest preventive care billing submissions. We can help improve or maintain the highest target achievable for your preventive care bonus and provide insight on potential revenue. That is the end of our webinar. On behalf of drcare, thank you for joining us today. If you have any questions or have feedback on this webinar, please feel welcome to contact me anytime. My contact information is listed on this slide. Have a great day.